myofascial chain or myofascial meridian. Okay, so this is again just ordinary moisturizing lotion. If you use an alcohol-based lotion, it will pit and degrade the cups, and you won't be able to clean them or sterilize them. So you just have to make a choice about that. But in general, I just use rather than woodlock oil or Posamon or one of these liniments that has alcohol in it, I'll just use just a regular moisturizing lotion. Okay. Okay, so I'm going to just cover the entire area, and just going to wipe my hands off, add to that effect considerably. Okay, so it doesn't really matter where you start. I don't generally go above the cervicothoracic junction though, so I'll do a smaller cup about up here, and that's usually about as high as I go. I found personally, having been cupped up here, right in the neck itself, pretty uncomfortable in a way that doesn't feel good. It's not sort of hurts good pain. It's like and these generally I'm going to use bilaterally symmetrical sized cups. I'm just grabbing them somewhat at random here. This particular set has a lot greater variety of cup sizes than some cupping sets, but you get the idea here. Now, really, actually, I want to cup as close one to the other as I can. And again, that's something that's easy to do with a vacuum pump cup, harder to do with fire cupping. So if I just pop that off there, because I left too big a gap there, I can just do it again really easy.
Yeah, I thought we were going to watch some Netflix.
Okay. I don't use the little magnet things myself. If you're into magnet therapy, you can do that. I found them really uncomfortable again, so not a hurts good pain, but just like ouch, just like a sharp metal object poking into skin that's already being highly stretched here. But if anyone's used those and gotten good results by using the little magnet inserts, I'd be interested to hear about it. Okay. So I'm only going to do a couple more here, but typically I would go all the way down the posterior chain until I reach the level of the iliac crest. And below that, there's nothing really wrong with going there, but you're no longer over ligamentous tissue. When you're over the sacrum and the SI joint, you're no longer over muscle tissue. The sacrum and the SI joint are ligamentous tissue, which I don't particularly want to stretch. And this is really for the muscles, the paraspinal muscles. Now, what I will I'll do this with a patient lying face down, and then I'll have them go up on their hands and knees and start doing, from yoga class, like cat and cow, flexion extension of their lumbar spine, add a little side bending, add a little rotation, just take them through all the planes of the range of motion. And Greg, if you're bold, you can do some of that seated, or you can do it face down, however, but try moving around with the cups in place. That one was a little loose. Okay. Another big advantage of the vacuum pump cups is that it's so quick and easy. One comes off, gets a little loose. I don't have to set the building on fire and trigger the smoke alarm. There we go. Just right back there. Okay. So you can flex. You can extend backwards the other direction. Now, I learned this technique from a physical therapist who had learned it from an acupuncture physical therapist team that co-teaches this at UC San Francisco. University of California, San Francisco Major Medical Center, mostly to physical therapists. And this is sad to say, is that initially they were quite open to an inviting acupuncturist, and they found that most acupuncturists' anatomy was insufficient to teach the class, and it really slowed down the class. And so they were like, okay, we're just teaching it to PTs now. So if we up our game a little bit and have a better grasp of functional anatomy and kinesiology, we're going to be able to be treated more like peers in these kinds of situations, rather than a nuisance, be a plus.